So thank you for inviting me to talk about and share my view on the breast cancer control in Hong Kong. In the last 20 odd years, breast cancer has been the #1 cancer among women, affecting women in Hong Kong. You can see from the trend that the red line is the breast cancer, and from 1994, it is about 1,000 cases per year, and now it's over 4,100 cases a year. So the increase in incidence of breast cancer outweighs the rest of the cancers like the colon and the lung cancer. So the latest figures in Hong Kong, according to the Hong Kong Cancer Registry, stands at 4,108 cases of invasive cancer in Hong Kong, and ranking #1. It occupies 26.6% of all cancers affecting women. The median age is 56, and the lifetime risk of women here is 1 in 15. Unfortunately, you can see from our registry, cancer registry data that 24% of the women are diagnosed in this late stage 3 and 4 cases. And this is in contrast to countries where there is population-based screening, where that's the stage 3 and 4 cancers is less than 15%. And you can see from the chart here, most of the cases are detected cancer by themselves, and only less than 10% are detected through mammography screening. In Hong Kong, there's only opportunistic screening available at centers, and women have to self-refer themselves. So the current strategy on breast cancer prevention and control issued by the Hong Kong government is in twofold. One is primary prevention, and the other is secondary prevention. Primary prevention meaning reducing the risk exposures in women. That is maintaining a healthy lifestyle, increase exercise, eat healthily with less meat and dairy products rich, and also breastfeeding, reduce alcohol and smoking. In secondary prevention, it means that detection of cancer at an earlier stage, hopefully that will increase the survival opportunities and also reduce mortality in breast cancer, which is evident in a lot of countries providing population-based screening. And so this is recognized as a good measure for early detection. But women in average risk are all advised to be breast aware. That means that they have to be familiar with the change in the breast and report to their doctors promptly when there's suspicious symptoms. Only for women at high risk, like those with family history of breast cancer or gene mutation carrier, or those who have childhood chest wall radiation for lymphoma, are recommended to undergo mammography screening annually. So let's look at the data from the Hong Kong Breast Cancer Registry run by the Hong Kong Breast Cancer Foundation. We found that only about 10.8% of the breast cancer patients have first-degree relative affected by breast cancer. So 84% of women do not have any breast cancer family history. So I think the current strategy recommended in Hong Kong has to be reviewed. We have to understand what are the risk factors for breast cancer development in Hong Kong, and what is the level of awareness of breast cancer among women in Hong Kong, and what should be the preventive measures for women with high risk or with average risk. So from the Breast Cancer Registry, which has recorded more than 20,000 cases now, it covers about 40% of all breast cancer patients diagnosed in Hong Kong. And we look at the prevalence of the risk factors. And we found that those with no childbirth, early menarche, early first-degree relative and late menopause ranges from 26% to 3%. But for modifiable factors, 78% of women do not have enough exercise, 66% do not have breastfeeding, 37% of patients reported a high level of stress, more than 50% of the time, and the use of hormone contraceptives and obesity and dairy products and meat-rich diets. But you can see that drinking alcohol, smoking, and hormone replacement night shifts, these are only less than 5%. This is not the major cause or risk exposures among our breast cancer patients. So with that background, we conducted a case control study, which is the first Hong Kong case control study, comparing risk exposures of breast cancer patients to normal populations. And among these over 10,000 patients, what stands out are those in red. You can see the modifiable factors include high level of stress, which gives a 240% increased risk of breast cancer compared to normal, 80% increased risk if they have a diet rich in meat and dairy products, 53% increase if they have less than 3 hours per week, and 46% increase if they are obese with a BMI of more than 25. For non-modifiable factors, obviously, first-degree relative having breast cancer have a 188% increase. Early menarche also stands out, and first life birth after age of 35 as well. These are all statistically significant. So the other study that we look at is the awareness of breast cancer among Hong Kong women. So 800 women are called, and you can see that less than half of the respondents know that breast cancer is the most common cancer in Hong Kong women. That means more than half of the people do not know that Hong Kong women is mostly affected by breast cancer if they have cancer. And among half of the respondents do not think they are at risk of breast cancer, especially in older age patients. And 60% of the respondents knew that risk of breast cancer increases with age, but paradoxically, the older respondents thought that when they get older, the risk decreases with age, which is not the truth. And if we ask them about the knowledge about the symptoms and signs of breast cancer, 24% of the respondents cannot name any symptoms of breast cancer. Among those who have some knowledge of breast cancer, 86% know that lump is one of the symptoms, but all the others, like nipple retraction, asymmetry, X-ray node swelling, nipple retraction, and skin changes, the awareness of these symptoms are very minimal. And we ask them whether they undergo any regular breast examination themselves, either by breast self-examination or examination by doctors or nurses, mammogram or ultrasound when they're older than 40. Only less than 1/3 of the respondents would undergo any sort of breast examination. So the reason of mammography screening is the gold standard among all the other countries undergoing breast screening. So the reason why women in Hong Kong do not undergo breast mammography screening, 20% said, "I'm healthy, I do not see the need to do it." And 19% don't think they have any symptoms in the breast. They thought that any cancer can be felt, so if they don't feel anything, it is okay. And 13% have doctor's examinations that I'm well, the doctor doesn't say I have any problem. But 12% stand out to say that the test is very expensive. At the present moment, at the NGOs, it costs about $1,000. In a private setting, it costs almost like $2,000. But 80% of the women will say that if it's free of charge, they will go for the screening mammogram. So the summary is breast cancer is an important cancer threat in Hong Kong. It's a public health issue now, looking at the trend, which is still increasing. And most of the cancers are detected only by self-detection, and a very minimal number go through mammogram screening to detect the cancer. The 24% of grade stage 3 and 4 cancers in Hong Kong is not quite acceptable in Hong Kong being a modernized and cosmopolitan city. So measures should be taken to reduce the incidence and mortality of the cancer, although we are enjoying a very good treatment outcome, but still there's room for improvement. So the current policy for prevention and control of breast cancer should be updated. Our recommendation is that in view of the low awareness of breast cancer in the community, measures should be devised to enhance breast health education and cancer awareness. Second is to decide on the policy and also to implement policy on breast cancer screening for women at high risk and average risk. Although we see the policy is there, but there's no implementation plan on breast cancer screening in Hong Kong for the community at large. And community-based breast health centers should be set up, which will be dedicated to provide breast health education, screening, and diagnostic procedures to help to reduce the bottleneck of diagnosis in our public hospital system. Thank you for your attention.